Still getting here, and it's fine, but as always, we want to try to respect everyone's time, so we're going to go ahead and get started. For those of you who are this is your first meeting, you'll find that we try to start them at 5 o'clock, and we try to end them at 7 o'clock or before. We try very hard not to go over, but part of that means starting on time. So we're going to go ahead and get started. Feel free to get up, and if you want more to eat or anything at all, do that. But we're going to talk really to get started. So the first thing we would like to do is introduce our new folk to those of the rest of the All Partners that are here. You'll find many more coming in late. You guys took off all your badges. I mean your name tags. What happened? I need them. You thought I was just having you do that just for fun, right? No, it could help me too. They fall off. Yeah, I'm just kidding. So what we'll do is we'll have Amy lead the introductions, and then we'll go forward with the rest of the program.
So I just wanted to, I'm going to have everybody introduce themselves, but we're going to do it in 2 phases. So first we have the CHI project staff is here with us. They started at the same time that the data collectors started. So Tara Powell has joined us as the field coordinator. That's Tara. Tara comes from us. She had served as a community organizer for the Baltimore Education Network. And we're super excited that she's with us, and she'll be working very closely with the data collectors. Maren Solomon joined us as the administrative coordinator for the community. And Maren comes to us having worked for close to 4 years with the Yo Center on the east side on a project called Healthy Minds at Work that was run through the Center for Adolescent Health. And I know we have a large number of our data collectors. And what I'd ask you each to do, maybe starting with you, Ms. Constance, is to just introduce yourself and let folks know one great thing about yourself.
Good evening. My name is Constance Maddox. I've just been brought in as a CHI data collector for this program, and I'm a community leader, and I've been very active in the community.
Great. All right. Let me go back.
My name is Chantel. I'm a data collector.
Now, can you hear Chantel? Now that ain't gonna work, Chantel. Come on, speak a little louder.
My name is Chantel Ward, and I'm a data collector, and I love receiving information and education.
And we trailed off at the end, but I'll let you slide. All right, let's see. There we go in the back.
Hello, my name is Amira Benson. I'm also a community leader, and I enjoy learning and enriching my mind.
Great. There we go.
Good evening, everyone. My name is Althea Smith, and how I give back to the community is I facilitate current organized meetings at my children's school.
Which school is that?
College Square.
Right around the corner. Good.
Good evening, everybody. My name is Elysia Pryor. I'm part of the Daytime Collective, and
Just ambitious. All right. Well, what do you want? What are you ambitious for? Something you want or something you're trying to achieve?
a lot.
Like what? Tell us one thing. One. To see through it, you're going to get through it. Huh? That doesn't count. All right, let's see. Who else? Where are the rest of our data collectors? No more? Gotta be more. Huh? Not right now. They are out there or somewhere else. All right. Okay. Well, there's more. We have 15 people that we brought on board, 12 and 2 or 3 alternates. So get to know them. You'll be seeing them more and more as we go forward. So they've been going through a little over a week so far of training, and they'll be going through one more week of review and training before they'll be finished on next Friday. But maybe we could take a few minutes to hear a little bit for the sake of the others who haven't been here or haven't participated in doing the training, although they know about what it was supposed to be about, to hear some reflections or thoughts from data collectors or those of you who are here about the training. How has it gone? Are you learning a lot? Is it crazy? Or what do you think? Anybody?
I will go. I'm enjoying the training. I'm enjoying the learning. It actually helps me to become a more effective learner and an effective, great listener with my listening skills.
Good. So what was your most favorite part of the training?
My most favorite part had to come from...
No, stop. You're supposed to say my lecture. I'm just kidding. Which one? What were you going to say?
I actually like doing the interview process.
Actually doing it, practicing. Great. You're going to get a lot of activity doing it. Yeah, Ms. Johnson.
Yes, as we work along, it gives you more confidence, and you get to meet different people in the community, and you learn to listen. And that's the most important part for me, because I like running my mouth. I think I got a lot of information when I'm with people. Ignore him. But it's actually an open conversation type of interview that we're doing, not going in and asking questions. We're looking for the assets as to what others can bring to the community. This gives them a chance to tell us what they would like to see happen, what they would like to do, what they would like to be involved in. And also it's a story-like concept. I believe that we'll be collecting the data to find out exactly who can help and who's willing to help in making a better East Baltimore.
Great. Yep. I'll be first.
Oh, okay. Well, so far, I think the whole entire training has been very interesting and been a learning experience. However, the most important piece that I really got out of this whole thing was the educational background of John Hopkins, because that was like unexpected to me. I didn't know he was doing training specifically geared to the data collector, not to know that was incorporated in it. So I actually gained a lot of knowledge about the history of John Hopkins.
Yeah, that was Stephen Ragsdale lecture. I heard a huge amount of positive about that session. Good. Anybody else want to just share their thoughts? Yes, tell me your name again. Alethea, that's right.
As far as the training goes for me personally, for the last 2 weeks, I didn't really think it was training because it was such a relaxed atmosphere. It was different for me the way it did. It was training because we learned different stuff that we're now incorporating today when we started doing interviewing and yesterday. So the best part I liked about it was strengthening my skills on active listening, because I realized I had a lot of work with that active listening. And the virtual project, that was really good.
Good.
Giving everybody information on the other side. And also just being able to interview people now. Something I never had to do, I was always interviewed.
Okay. Good. You hear that, Jerry? Your program coming up over and over and over again. All right. Anybody else want to share with each other? So we have a couple more. I think we have our youngest data collector, but you want to just introducing all the data collectors to everybody else. Just tell us your name and a little bit.
Oh, my name is Eileen Thomas. This is Jackie's son, Little Woody. Had to bring him. And That's about it.
All right. Did anybody else come in that I missed? Any of the data collectors?
No.
Okay. Okay, great. Good. So the training's ongoing. We got another week, and then after that's done, we'll be out there. We'll be in the field. Maybe would it be helpful? I know you've heard about it in bits and pieces. Now I'm talking to the data collectors. Would it be helpful to hear a little bit of what? See, all these other people sitting in here have been involved for some of them for more than 2 years in leading up to this point. I can't remember if you know that now, or would it be helpful to hear about some of that from them? Would you like to hear some of that?
Yeah.
All right, rather than me tell it, is there any of the all partners that are here that want to just start, not tell the whole story, we'll break it up into a few people, but anybody want to start? Just maybe some of you who might have been around in the beginning, or tell a little part of what this is all about and how we got here? Okay, Pat, and then, okay.
Yeah, well, people behind me. I guess what I like about this process is that it brought a lot of community groups together to give their input about, how do we go out, how do we do this, how do we strengthen the partnership, or even how do we make it kind of a working relationship with the different partners, because that's the toughest thing when you're doing this kind of a project, is to get everybody to come together and walk away with, or to get to this point where we actually have people come together to start doing the thing that we want to get done. That's kind of the thing that I'm really excited about, that it's really going to happen. Because a lot of times we start so many projects and we never can get past everybody's stuff. I don't know how else to say it.
Yeah. Good. Ernest, did you want to share a little bit? Ernest?
Yeah, for me, having been here for pretty much almost since it started, it's more like a journey of, and Pat hit on a couple of things, which was at the very beginning, everybody came in with an idea, and it was all around health assessment. But the problem that we all faced was we all came here with our own notion, and we came here with our own biases. And as a result of that, we literally had to figure out how to work together. And out of this, a lot has happened, and for many of us who have been here, when this thing started, we saw one thing. And I've talked about this a couple times with Chris and with Bob and a couple of the other all partners. And then all of a sudden, a couple months later, it's something totally different. And then we got to this point where we wanted to do this, and all of a sudden it has changed the game. But the best part of it all is in all of those changes, we are really about to embark upon something that we all feel to be important, and something is about to be done. And everyone can feel in some way the contribution that they have made. And I think for all of the partners and all of the people who have been involved, this is ultimately that time that we have all been waiting for, that something will begin to happen, that we can begin to gain that understanding about East Baltimore, and then begin to look at and be able to reflect on how we can begin to engage East Baltimore and bringing about the changes.
Good. Bob, Adrian, Phil, any of you guys want to give a little context about the early days, and maybe fill in a little of the early details for some folk? Not forcing you, but if you like, it'd be great.
I would simply say that we've come a long way.
To put it lightly, yeah.
There's a ways to go.
A mighty long way.
But we've come a long way.
Yeah.
And it's great to see this.
Yeah. Adrian or Phil?
And I just think if you just look around who's in the auditorium, I think it sort of reflects how far we've come in terms of really engaging lots of people from the community who are actually going to be getting the information about how people in the community think and what are helping them, so we can all work handle.
Yeah. Yes.
I want to comment on the interview.
Is that Rebecca? I can't
Yes,
see. Okay, I wasn't
Chris,
sure.
hi.
Sorry.
I had the pleasure of participating in the interview today, and what was really exciting was after the interview was done, I chit-chatted with my interviewers. Hopefully that was acceptable, and some things that really got me excited from what they said was that through this, one, we did not think the training will be this intensive. So there was really clear depth to the training that folks didn't anticipate. And then the second piece that I heard clearly was that, from my colleagues, was that we learned lifelong skills. These are skills that we can apply in other jobs. So I thought that was
Good.
fantastic comments that I got from my free time.
Good.
Exciting.
All right. Anyone else? Don't want to leave anybody out. Adrian?
I'm just going to say something because people don't believe that I can keep talking. and so I'm going to live up to what I do and say something. I think that...
So those of you who don't know Adrian, she's better known as Mom to all of us, all right?
Adrian's a germ. I think that what we all had in mind when we started out, and even we had our own separate agendas of what we want, what information, what change, what the feelings we wanted to come out of the process. We also wanted this process to be a community-driven process. And knowing what the reputation, the history, the past relationship of Edward Hopkins, and its community, as I said, its community, because it is part of the community. Getting to that definition of community, Hopkins is a member of the community. Was very, very hard. And I'm not so sure we're quite there yet, but we certainly have a piece of art in place where we can recognize the elephant in the room and talk about those things that divide us without shedding blood. And it's really important. I mean, I've been at this stuff a lot of years, and I can honestly say to you that I'm extremely excited to see everybody at the table and working hard for something we all want. And so that's sort of just all I have to say about it. I'm excited.
Great.
I don't look it because I'm sick. So I'm excited. I usually look different.
All right. Yeah, Jared.
I just want to make a true confession. So in the methods committee, after we had tested out our instrument and found it wanting and nobody liked it, and there was only one person who liked this interview, that was my partner, who some of y'all met today, Michael Scott, who came to be interviewed. And then we went back to method committee and everybody said, okay. So, we talked about the method, and I remember Nan turned to me. We talked about listening and using these what and how questions and all. And Nan turns to me and says, yeah, but can you teach that listening skill? And completely with a straight face, I opened my mouth and lied and said, well, absolutely. And I knew that you could do it, and I've done a lot of virtues training, lots and lots of it, and I've seen people make that transition, but I had never used it before for data collection. I used it for a social change research workshop in Toronto with some researchers who weren't trying to hear it. They just wanted to know how to write a good CV and get a job. So yeah, I totally lied to you people. I knew it was possible, but I hadn't done it before. And I'm here to tell you, I was this afternoon, what did you hear everybody say? They learned to listen, 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 and listen. It worked. Am I right?
Yeah, absolutely.
It absolutely worked. So, boy, I'm glad. Glad I pulled that one up.
Great. You, I'll say somebody else, I don't want to cut anybody off. You definitely, as we talked earlier, part of a bigger, broader movement that's been going now for over 2 years. Sometimes it's been tough, but it's been worth it. I think everybody that's stuck with it agrees with that. And we're going forward, and you're an important part of that project. So one of the things that we wanted to talk about tonight is, there are many things eventually we'll talk about, but one of the things to talk about tonight is how do we actually find people to talk to? Nan, did you want to lead that off or say anything? I'm not, you don't have to, but I just didn't want to
No.
step on anybody's toes or anything.
Sorry.
Sorry, no, I should have looked before
I am happy to.
Okay.
So I can certainly do that.
Sure.
For those of you who don't know me, I'm Nan. I have not been around since the beginning, but I've been around for
A
about
long
a year.
time, yes.
For about a year. And I co-chair with Ernest the Methods Committee, and the data collectors I met in part of the training. So let me just verify the schedule is there'll be more training next week.
So, yeah, it'll largely be reviewed, but,
Right.
but it'll be the whole week and the exam on Friday.
Okay, so I think that so that the next step, once we're trained, is to go out and start, right? So how are we going to do that? And I think the first thing that we need to do, which I've done, is to think about people that you know and individuals that you know, actual, like specific individuals, or groups of individuals that you think will be important to talk to. And begin to feed names and categories of people to Tara. So just to use myself as an example, one thing that I did was, I think that one of the most important assets in any community are the Girl Scout leaders. Probably the Boy Scout leaders too, but I think almost of the Girl Scout leaders. So I wrote to the person at the Girl Scout Council of Central Maryland, which runs the Baltimore Girl Scouts, and I looked around on the website to see if I could find a person who works at Girl Scouts but who supervises the leaders. And I found somebody who did that, and I wrote to them, cold writing. But I did a couple of things. First of all, I identified myself as a Girl Scout leader. So I emphasized in recruiting something that I had in common with them. I explained about the survey and the project, and I told them that I thought Girl Scout, I used a little flattery. I told them that I thought Girl Scout leaders were really important assets in the community. That's not a lie, I do think that. And then I said, could you give my name and my information to anyone you think of who might be interested in talking to us, and have them call me. So a couple of principles just about recruiting is that I tried to call attention to similarities between myself and other people, which I think is an important principle. I didn't ask anyone, any third party, to give me the name of a third party, which people are very hesitant to do. I asked them, would you send my name out to all these people? And I explained briefly the survey. And I had a message on my machine the next morning from somebody who wants to be interviewed. So I just throw that out there as a model of not that I'm holding myself up as this great person, but just that that's one of the things that we all need to do, I think, is you think about our own personal networks. Not just of individuals, although some of you might very well, some of the data collectors and some of the all partners might actually know specific individuals who've lived here a long time or who for some reason are very knowledgeable that you might want to recommend personally. But I think it's really important for us to all think about the resources in the community. Now I know the community folks have a lot, there's other folks that have a lot that they want to talk about. So I want to open it up, but I just throw that out as one example.
You know what might be helpful, maybe talk to you first, because I don't think it happened about sort of, not a lot of the methodology, but essentially we need a 100 essentially in each of the 5.
Right, right. Yeah. Oh, you mean like the different, yeah.
Well, so what we don't want to do is to get all our interviews from people who just live around here, right around, or live around your house, or live around my house, or whatever. What we're trying to do is to get them spread out across people across all the 5 zip codes of East Baltimore. And really, we're trying very specifically to do that. We want to do about a little more than 100 interviews in each of the 5 zip codes. So as you're thinking about people, or as you're thinking about places or whatever, try to think about in different places. You don't have to worry about, thinking of somebody and then just going to do it. That's not how it'll work. As Nan was saying, we think about ideas, think about places, people, and then it'll go to Tara, and then we'll have a system to figure out, where these people are. And if we're starting to get too many in 05, we might not need as many there, or we need more over here. So we just need to keep the ideas coming. And they'll both be from you and the people you talk to, and things like that.
Yeah, I think, a couple, the dimensions that we've talked about in terms of making sure we have sufficient. And this is not a kind of survey where we actually identify a specific person and say we've selected them through a very complex scientific process, and if that person is not willing or not available, we can't just take his or her next door neighbor. We have to have that person. This is not like that. Having said that, and we talked a lot about this at the last All Partners meeting, we do want diversity. So the first and foremost, Chris has already talked about, right, the 5 zip codes. We know that to some extent our All Partners group has really been at 05. I think we have a lot of folks who participate from 05, so that some of the zip codes have had more participation than others. So we need to get out into all 5 zip codes. We certainly want to talk to both men and women, because men and women have a different take on the world. We want to talk to people of a variety of ages, and roughly in our heads we've divided people up into 3 groups that way. 18 to 30, sort of young people starting out. 30 to 55, sort of the people who are out working in general, will have kids or be responsible. And not that other people aren't, just that, the sort of main working ages, and then people over 55. So that's roughly speaking how we're thinking about the age groups. And so, again, if we're finding lots and lots and lots of older people from one of the zip codes, we might actually issue calls to say we need younger people from that zip code, or we're getting a lot of men from that zip code, we need women. And we talked last time about ethnicity and socioeconomic status. We want to make sure that we are reaching we've looked at census data, and that we're reaching a group of people who actually live there. So we don't want to skew our data all to very, very highly educated people, or to all to very, very poorly educated people. We want a mix of education, and we want a mix of African Americans, Latinos, and European Americans, depending on which zip code we're in, because the ethnic differences in the zip codes are different. So we're looking for all kinds of people.
No, I think that,
yeah. But how are we going to do this? I mean, that's, I think, the question is, how are we going to beat the bushes, basically, for people to participate?
one of the things that I understand Jody talked about, and maybe we should have talked a little, I didn't hear his message, I had to leave after I introduced him, but you guys are here. But what I understand, part of what he said is, starting with each of you, data collectors and others, if you could come up with 10 names, 10 names of people who you think, for one reason or another, would be great people to talk to. They lived in East Baltimore a long time, they know a lot, people trust them. If somebody has a problem, they go to them. How many of you think you could come up with 10 names like that? Some of you a little easier than others. Well, as we go through the next week, start putting your list together in your mind. You don't have to give it to Tara yet or anything like that. But just maybe start writing them down and start thinking about it. Because the more you think about it, the more, oh yeah, I didn't think about her or him. But that's one way to start. Anybody have any other ideas about how we find the right type of people or more people to talk about? Where would you go in the community? If you wanted to, maybe another way to look at it, there are certain places where the right kinds of people go. Where are some of those places in East Baltimore? Were you going to say something?
I was looking at the possibility of, years ago, I don't know if it's still continuing, but the mayor had a directory. And the directory of community leaders, those that are truly active in the community in different aspects, housing, youth, you know, the whole 9 yards. These people have a great connection with the actual people out there, and I'm sure that a lot of stories are related to them, or they have experienced a lot of them. I was wondering if maybe that directory could be helpful, because it does get in there, and they are male, female, different ethnic groups, you know, the whole 9 yards. That would be, that's where I would start. Because the suggestion is, when we have a newcomer or someone that wants to introduce something, we suggest to them, find the mayor's directory, find out who's the leader in that community, because if they're active enough, they're having community meetings and they're having people informed, as opposed to you just coming into a neighborhood, knocking on doors, causing stress, because these people contact us back. Did you know such and such was in the community? Did you know this happened? You know, and for me myself, if I might live 5 blocks away from an incident that is happening, but it'll hit the domino effect, and eventually my phone won't stop ringing. So I think the mayor's directory would be a good place to start to contact these people, because a lot of them are partners here in this group here, because I've been to some of the partnership meetings, you know, when they first started, and I don't see them here today, but their interview or their access to the community could be useful to us as
That's exactly, I mean, those folks to be interviewed themselves and to recommend people.
I haven't seen that book. I know I've seen the one about community-based organizations, and there's over 900 of them in there. But I believe you. I mean, does anybody know or have a copy of that book? Or?
I have an older copy, and it's broken down North South Beach as well.
Is that right?
Yes.
Well, maybe if sometime next week you're willing to share it with us, we can at least look and see where it came from, and maybe give that office a call. And,
well, mind you, like I said, I have older copies, so
yeah,
some might be still active.
What's that? It might be. I don't.
More than likely it is, because they have been calling asking for email addresses.
Okay, good. Yeah, if you could share that with us, that would be helpful. It is online. You know about it? Okay, great. So we've got a few people in here who know about it. So that's one resource we can use. Any other? Yes. No, I'm trying to remember your name. Alethea.
I don't know. It's a suggestion. I don't know if it's helpful, but like years ago, I'm from East Baltimore, and I've been in all of those zip codes. Like, it's probably already been talked about. It could be one flyer or maybe several flyers in certain areas like Northeast Market or the churches that we're affiliated with in the area. Big places that hold a lot of people that will see this and they maybe want to be a part of it. There's the flyers and homeless.
Yes. Yes.
One place I like to leave flyers when I'm trying to advertise something is the laundromat, because people, I mean, when I'm in a laundromat, I just want something to read to alleviate the boredom. And so my feeling is that, you know, if I'm going to church or something, I might have stuff on my mind and go right by a flyer, but when I'm at the laundromat and I'm just sitting there, I'll be actually reading. So
yeah,
that's
and we did, the group, the All Partners group, the communications team did develop a flyer, at least one, maybe two, I can't remember. Is it one or two, Edie? At least one flyer.
We have a brochure that we got some feedback from, and a number of people provided written feedback from the last, in follow-up from the last All Partners meeting, and we're having back with the person who's doing like the layout.
Oh, I got you.
And we'll have another draft to come out. In the meantime, we do have one that doesn't look as pretty.
Okay, so we've got a black and white one, and we got a really nice one coming, so we will have that. And so yeah, we will have that. Where are the kind of Nan suggested the laundromats? I think you said churches. Where are the places that these things need to go? Beauty shops, barber shops. Yep.
different forums and different events, because there's a lot that's really taking place. I know a lot of schools are going into their back to school nights, so they want to be there. Because that's how I found out about data collectors. I was actually at a forum about the Baltimore City Public School budget, and we're actually in, Ms. Ernst was talking. He asked me how I found out about this. Well, it was a SAG album there, and I'm the kind of person where I'm getting some resources, so I grabbed one. But the people are already at back to school now, so I think that's a good idea. Then they have BBC, Baltimore Education Coalition. They did have an event at KIT, so we have a lot of people there.
Well, if you could, one of the things we try to do, although it's hard because nobody knows everything, but it let us know when or where these events are so that at least we can make a list, and then we're going to be, that's part of the activities we all will be involved in, going to some of these things and putting these out. Yeah, great. Yes.
Senior centers?
Senior centers? Okay, good. Any other? Yeah.
It would probably be good if people could actually send us addresses of specific places that, you know, so that we can, because just so we can go directly there and we know ones, yeah?
And also, I mean, certainly once there's a finalized brochure and flyer, our hope is that everyone will have multiple copies so that as they're going about their daily lives, they can leave them behind.
Go ahead.
I was going to say, at the community college at Baltimore City,
Uh-huh.
I go to the community college every day. I don't know if they get a yes or no, but like they have places where we could put flyers around and up on the board because the college is set up where so many people go there. Even Essex Community College, I know a lot of people in Baltimore, they don't come to the city, they go to Essex or Dundalk.
So there's 2 points. One is the specific point that community colleges are in place. But the second point you're making, which I think is really important, is if you know of a place where you know a lot of people from East Baltimore are, but it's not in East Baltimore, we should still be recruiting there. I think that's a really important point. And in terms of this, Bob, close your ears about my boss. My own view on this is it's always easier to ask forgiveness than permission. So I would just put the flyers out there and let them tell you. Yeah.
Let's go, Reverend Hickman, and then we'll come back on this side over here.
Yeah, it was already mentioned about the churches, but more than putting the flyers in the churches, because they have a myriad of flyers, is to actually send or get in contact with the pastor to ask for 2 to 5 minutes on their announcement section to actually make that announcement and be available to answer questions after service.
So you're suggesting not the pastor, but one of us be at the service to do that?
Correct.
Great.
And also at the recreation centers like the Dome and places like that where there are a lot of people that are frequenting there if you're going to pass out flyers.
Great. Adrian? Oh, I'm sorry, I didn't see you. Go ahead, Adrian.
Very connected to that is like the transformation team and Eastern District Police people getting flyers in their hands.
That's true.
All over the place.
Yeah.
And then there's the Dunbar alumni breakfast scheduled for next month. It's going to bring a lot of people. There's lots of places. So.
Okay. We're going to, Katania's taking these notes as fast and furiously as we can, but the ones that we don't know the dates or the addresses, we're going to be trying to reach out to you, and if you can just let us know, specifically when and the address so that we can start moving on some of these. She did.
No, I was going to say, like she was saying, schools, my school, Strayer, is on White Marsh, but most of my classmates are from East Baltimore.
Is that right?
Yeah.
Well, that's what Nan was
They
talking
just go
about.
out
That's
there,
good.
We all live.
Okay. All right. Well, then we can do that. Yep.
Thanks.
Okay.
I think also, if I'm understanding this correctly, we're not necessarily going for just people that are outspoken, that already present themselves as community leaders.
Right.
We want that person, maybe when you're in church, who's kind of, who's there every Sunday, sits and is quiet, and yet is filled with information. And engaging those people, bring kind of, that more quiet person and to the forefront. And going along with the parents, I think parent community engagement, talking to some of those people is big too.
Yeah, no, good point. It's not just always the people that are willing to stand up and talk, whether it's at the community center, at church, or whatever. Sometimes it's the person who's quiet, but has been there forever. you know?
My
And-
suggestion was, that it's not them themselves, that they should forward us to someone.
That's a good point. You can, if people don't want to be involved themselves, you can always ask them, do you know somebody that we should talk to and give us that information or help us get to that person? Absolutely. Oh, sorry. There. Let's go there.
Amira was first.
Okay.
The area where I live at, they kind of form and migrate and don't kind of stray out that much. So the only way that they really get out information is by going to the community meetings. So my thing would be, is there a way that we can find out like each zip code, community meetings or association, and not just about the flyer, but someone go and express, the program, because everybody want to look at a flyer and they're going to say, okay, and read it. But if someone go and they show how passionate they are about this project, we can probably get more people than just a flyer.
Yeah, that's a good point. I mean, I think there, like I said, I've seen in the past one of these manuals that lists the community-based organizations and things, but I don't
find that online.
What's that?
You should be able to find that online, really.
I think so.
We have one. Larry was kind enough to send it. We were going to print it out, but it's 140
Yeah, it's
pages.
big. It's big.
So what we'll probably do is upload it to the Indie Health Initiative website, and then if there are specific groups that that we should start with, then we should discuss that as a...
Yeah, that's what would be helpful. That's a big book, but like I said, at least when I saw it, there were over 900 in them. We can't go to 900, and maybe we don't need to. But which are the ones that we need to go to?
Probably the ones you actually find online, because some of them actually may have a website online, or you may be able to find a reference to them online. So at least you can get the contact information. So usually those are the groups that are more active, right, and have a larger voice in the community.
Okay.
Well, actually, what you should do is it breaks it down by zip code and by the area. It says Eastern District. It breaks it down actually by the districts. It says Eastern District. It says Northern District. It has all of the districts. And so even if you don't have to go through the whole website to print out all the pages, you can just print out the Eastern, the Southeast, and the districts that we are in and find out their community. Or the thing would be, we are the data collectors. The areas that we are focusing, targeted on, maybe one of the days that we're not in training or we're not doing something, we can actually do a walkabout.
Right. I was thinking about that.
To walk through and get information. Not to do the survey, but to meet and greet, because you never know who you might meet when you're just walking around.
That's right. Absolutely right. Yes.
I was similar to what we were also talking about the school system, like how I found about the program was the Head Start Center, and it was, even though it was, the Head Start is in West Baltimore, it still brought me over to this side of town for the position, because it is specified what, a little bit about what the position is going to be about. But like, it's a daycare locator, and not like Amira was saying, maybe if we could try to avoid a bunch of the paperwork and the flyers just being thrown out for some areas, and to get a wide variety of people from different lives, and not just one particular group. If we could either maybe, and if someone to help maybe have a direct contact person, where we would probably call some of the daycare areas, and not just in those zip codes, but maybe like scattered all over the place, because maybe some people may live here but then take their kids to school at another location, but still live okay, I can afford to live here, but then I have extra money to pay for their education there. So, so I think that would be a good idea, that we could try to find a daycare and a Head Start programs. Now, the Head Start, I would do East and West, because like myself, I came west, and then maybe somebody who drives west and live east.
Well, and people put their kids in daycare near where they work sometimes, instead of near where they live, so, just because the daycare is over on the west side doesn't mean they live on it.
Right.
Yes.
I was going to say, I'm not sure if anybody mentioned libraries as well, because a lot of people don't, just go there for reading and things. A lot of people go there for literature and resources. And I would say that local community action centers, a lot of people go there also to get resources.
Community action centers. Now, that's not like your regular community centers, are they?
No.
What's a community action center?
Like the services, like
Oh, okay.
they go there for different because they also like energy assistance, and they have a table just for resources and a bulletin just for that. And also, like she said, the mayor's office of employment.
Right.
They're going to home services too, but what I think said.
Yeah, good.
This is fabulous.
Yeah, these are all good ideas. Ernest.
And just because I'm hearing a lot of things, and one of the things that we can also do is as we identify, because it's always better if you have that person who can go through the door and know someone in there, thereby, because of that relationship, it's easier to get in a lot of these places to support you. So as we identify these places, maybe we can look at finding out who has that relationship with some of these organizations, because that way what will happen is when we go in, because they know that many of us are active and working throughout these Baltimore communities, it'll help to open up those doors and make it easier for others to be able to follow behind. And also it gives them, it also connects a face with the project. You know, it's easier when if something goes wrong, I have someone to talk to or to ask, well, what happened, you know, tell me more about it. Right. As opposed to just looking at a fly.
Absolutely.
I'm sorry, I just wanted to piggyback on what she was saying. Actually, I think the flyers is a wonderful idea, but also when it's someone standing up front that can present it, I think that's good. And I noticed at the community action centers, at the community action centers where they have resources at, a lot of times you'll see flyers, but people go there to have presentations and do like workshops.
Yes.
Or just sit at a table. I mean, if the place will let you, sometimes they won't let you, but I mean, if there's a place where we think or we're informed that the potential people to be interviewed might be coming in and out, we can approach the place and ask, can we set up a table and sit there to talk to people one-on-one?
Like a health fair
or just to set up a table.
Yeah, that's true. It doesn't have to be a health fair. Yeah.
The book fair is coming up.
Book fair. Is that a Baltimore? Who puts that on?
I'm not really sure, but it's going to be down at the Washington Monument.
Oh, right. Yes, that's right. That's a big book fair. That's right. I've been there. Yeah. That kind of shuts down that whole area. It sure does.
Friday, Saturday, Sunday.
You said this Saturday? Sunday?
No, end of the month. Friday, Saturday, and Sunday.
Okay. Then we'll go there, then we'll go there.
Farmers markets.
That's
So they
true.
can actually
A
sit
table
there.
at a farmer's market.
Jerry.
Yeah, just in terms of the book fair, I've done it for several years, so we're late to get involved, but if you know anybody who's going to have a booth at the book fair, that would be great to, like, anybody who knows, like, if they're a church or they're a community organization would be willing to put flyers out, we can have them all over the book fair, which would be much better than having a booth.
Yeah, that's a lot of people go to that. I went there once.
I don't know, what about like, I don't know if this would be something for the day, like, the process of it, if we don't, I guess, get a good outcome the way we need to, but like, I remember one time I was working for an agency, a temp agency, like, it wasn't Kelly Service, but something like Kelly Services, and I remember they had us stationed at the clinic on Eagle Street at Johnson.
Yeah.
And we were, I don't know if it was a project for Hopkins, but it was a project for someone. And we were sitting at, they had us set up at a table, and we were, I can't, I'm sure that was a long time ago. But we were taking information and going and talk to the people and giving them pamphlets and handouts while they were already there with their kids in the doctor's office.
There may be, I don't know, we can look into that. Places like East Baltimore Medical Center or JAI or some of the other healthcare providers, they may or they may not. It might be easier at EBMC because you're now a part of Hopkins, so that might be possible. We can look into that for sure. That's a good idea.
The theme there is waiting rooms. To talk to individual people, getting people in places where they're really bored and they have to sit there. That's my. That's when people will talk to you because they're really bored.
Good. Any other ideas off the top of your head? These are exactly the kinds of things that we need.
You know, down at Northeast Market, I know we only go there once a month.
Yep.
But there's no reason why there can't be a regular, people there on a regular basis with a nice poster that people know what it's all about.
Yeah.
And they'll stop and talk to you, because a lot of times they see you there,
Right.
and they'll just stop. And anyway, say, well, what are you doing?
Right.
You know,
Right.
if
Yeah.
you have a nice poster, then they can actually see, and some chairs, they can sit down, and
Yeah, there's that central area right there.
Yeah,
Sit
by the
ready,
food
ready.
court.
That's right, ready for this
so,
kind of.
you know, and that's free a lot of time.
Yep, absolutely, absolutely. Anybody else? Okay, so I think this is a good start, and as you go from this point forward, just kind of keep thinking in your mind, are there other places, are there other ways that we can add? We are going to be the ones doing it. This is not just give ideas and then sit back and wait for somebody else to do it. First come the ideas and then we explore them, but we're going to be looking to you, both the data collectors and members of the All Partners, to help us either, I mean, everybody's not going to do everything, right? But some people to help us pass out flyers, other people to make connections with people, other people to make phone calls to help us get into places and things like that. We need everybody helping us in doing some part of it. So as we go over the next few days, we'll be organizing that a little bit better and thinking about how to strategically go here and there. But we're looking for everybody and anybody to be involved.
But the point that Ernest made, I think, is the most important one. There's not, you know, no amount of getting the text right on the flyer or getting the right picture or anything. Nothing is as powerful as walking into a place where you are known.
That's right.
And doing a personal vouching for this. I'm involved in this.
Right.
You know, this is okay. Nothing does better than that.
Great, thanks, Nan. So we're getting down all these things, and we'll be back in touch with you about that. That was a major business that we wanted to talk about tonight. Really, just introducing the new data collectors, begin to get your thoughts on recruitment, and reflect on the trainings that as they've gone so far. One thing we didn't talk about is Jody Kreutzmann. How did that go? Data collector. The gentleman that was here that I introduced, we were talking. How did that session go with him?
It was nice.
Was it? What did he talk about? It's a test. No.
He talked about where he, I think he said he came from Chicago, and he was talking a lot about the South Bronx, people perceptions of it, that it was the negativity in it, but now like South Bronx has really changed.
Yeah, that's true.
And then he says the same thing, how people perception of East Baltimore is, so we can bring enlightenment on not only the negative things that people see in East Baltimore, we can bring to them the assets over here.
Yeah.
And he talked about a woman, I think her name is Edna Johnson.
Yeah.
Edna Jones?
Edna.
Johnson.
Johnson?
Yeah, she
Speak up a little bit so everybody can hear you.
Well, that's what I took notice to when he did the presentation about the woman. He was giving us an example that how she had called him for different, like, different affairs, like different times that she would call him when she would have something set up. And I can't remember, but it was like every time that he had came, he had sat down and had a talk with her, and it was similar to how we're being trained. Like, we're not going in to hear all the negative.
Right.
We already know the negative. Let's people, you know, we're looking for the positive things.
Right.
So, like, when he immediately started talking about the scenario, it reflected back to training.
Yep.
Like, because we already know the negatives and the good. Let's figure out the positive assets in it. So when he did that, it brought that out.
Absolutely. Chris?
I was here when he spoke, and I think one of the most vivid and probably impressionable analogies that he gave was, and I believe he got this from Ms. Johnson, was the cup. In that every community has places of emptiness and places of wholeness, whether it's a community of a high socioeconomic status or it's a community of a low socioeconomic status. but how it's important to first begin in the places of wholeness, meaning asking people what they see as right in their community.
Yeah.
So that when you allow people to express what's right or what's positive or what's a resource, then that becomes an impetus to then solve things that are lacking. And something he said that I thought was very poignant, especially for us in this room, is that sometimes as institutions, we gravitate to first look at what's missing. And that's a disservice to what's worked. Every community has a glass half full.
Yeah, yeah.
Every community.
Absolutely.
And I just thought that was very profound.
Yeah, he's the one largely, not only, but largely credited with helping communities really around the world do this kind of stuff. That guy that was here this morning, that guy, he's written a textbook on how to do this. People use that textbook all over the world, and he's been all over the world helping communities learn how to. He came here with us a year ago, came back to give you a little send-off today, and to show you not only, as Chris was saying, that your community is half full, but it can make a difference. It can make a really big difference, and that there's absolute truth to that. Somebody else had their hand up. Ernest.
He did two things. One was around what Chris was saying, how many people, institutions, look at the glass as half full, half empty. He also pointed out that not only is it people on the outside, but also people on the inside.
Right.
You know, most of us are really looking at the problems, looking at the needs, never really seeking to recognize those things that are working, that are good, that are positive within our communities that we can use to begin to build the framework for doing towards improvement and towards doing greater things. And that led us into an exercise that he did with everyone called the head, and the heart. And that exercise, because everyone, he had people interviewing each other. And from that, mostly the data collectors did it, but one of the things that came out of it is everyone began to recognize some people, even within that group, felt like, they were a part of this, that, they were learning a lot, but they could not see their own value. And although we were telling them that they were assets, many of them still did not see their value. But once he did that exercise with them, people really began to see their value and began to capture who they are and the value that they now bring to their communities, because they begin to recognize that they really do have stories, that they do have, that they are valuable instruments that are capable of helping to identify things within their communities. And that was kind of interesting with the way he did that.
Yeah. It's always easier to see the negative and think about the negative. And we did that little exercise earlier when I started, just asking you about the positives in the community and some of you struggle. Because even those of us who live here, it's hard. So we got to force ourselves to think about the positive and find ways to get the positive out of the people that we're talking to. Yeah.
And I was thinking, he also made a statement when he was interviewing someone on the porch, and the person told him that, they were living in a prison or living in a jail. And he asked them, what he said, he didn't see any bars up, or why did you see him in jail and you on your porch? He said, because the people that's on the outside are making choices and decisions, for us, or they speaking on behalf of me in a place that they never lived before, that they don't know about. So I thought that was very interesting.
Right, exactly. Yeah.
And piggyback on what she was saying, because and he made a comment, and he told me that it reminded him of what I was saying, because the thing that I was saying was that I live in public housing. And I had to define that, because the first thing someone says is you live in a project. And before you actually meet them. And that's the thing that I was getting, and I kept, you know, I had to always tell people, because I'm very proud and I'm very blunt about where I live at. When you walk on, it's no laboratory, it's no doctors, it's no scientists, so it's not a project. It's a community. It's just where everybody else did. So he kind of made me look at it in a different way, so that when I do say how proud, because he was saying that the lady, Miss Johnson, talked about how she lived in South Bronx, but she would try to make it seem enthusiastic about how she was saying it, knowing everybody will come back with feedback. And that's how it is. Sometimes I say, oh, they said, where you live at? And I said, oh, I come from Douglas Homes. Oh, you live in a project? No, I come from Douglas Homes. You know, so I had to keep internalizing that. Oh, no, I come from Douglas Homes. When, you know, the same paper or the same way that you pay your rent, I pay my rent. It doesn't matter. You know, just because I live in a box community, you might live in a circle, but I still live there. You know, it's still the same thing to me.
It's so true, my friends. If we can't think positive about where we live, why would anybody else think positive about it? If all we can do is talk about what East Baltimore used to be, instead, and not even focus on what it is now if it's not where we want it, but what it can be, what it will be, and what we're going to do to be part of that change. That's how we bring that refusal to look at things the other way is what other people say, well, maybe there is something to it, and eventually you get somewhere. But if everybody's only focused on the negative, only focused on what's wrong, after a while, you begin to think it's not possible to be any different, it's not worth anything, and go the other way. I refuse to believe that about East Baltimore. I don't care what it looks like. I just refuse. And if we have if it's 50 of us in here, the only 50 people in East Baltimore that believe that, that's fine. Let's go forward. But when we're done, it will be more than 50. And one day, East Baltimore will be different than it is today. It's not the same as it was last year, and tomorrow it will be different partly because of what we do in this.
You got an amen on that.
All right.
The one thing that you're going to find out is when you talk to people of different ages, because when you say what it used to be, okay, when I think about what East Baltimore used to be, it was a very nice place.
Yeah, I've heard it. I know.
It depends on what place and time
That's true.
you're talking about.
That's true.
When you talk to people of different
That's
ages,
true. Yeah.
you know, you're gonna get this good thing, this bad thing, a good thing. You know, you're gonna get this rotation
Right.
of what East Baltimore was about.
That's true. I've talked to people who told me, who's that? Somebody from here at your school, is at Collington Square. They've told me that up there in years gone by, the 60s, I think it was, in the 50s and 70s, that used to be a very nice area, a very nice park. People used to go out there and put their blankets out with their kids, just like any other nice park that we have in other parts of the country. And you could oversee East Baltimore, a beautiful place. Now, it's much different.
We did not have doors.
Right, right.
People could, you know, people see East Baltimore now, they can't believe that.
Right.
That there was
Exactly.
a time,
It's hard to
where,
That's right.
with the summertime, we didn't have air conditioning, so we sat on the steps 2 o'clock in the morning, and it was without doors open, and we felt very safe.
Right.
You know, so it's you know, it's where you are in time.
That's right.
As to how East Baltimore was.
Yeah.
After the riots, you know, when you talk about after the riots, then you see this deterioration.
Right, right, absolutely. Did you want to say something? Did you have your hand up? No? Okay. Yes, one more.
I wanted to just say something like, I just realized that I spent the last maybe 13 years defending East Baltimore because I worked in Pekin County, of course, everybody in Pekin County and Washington.
Right.
All they say is negative stuff about East Baltimore, especially East Baltimore.
Sure.
And I defend it all the time, like, oh, I don't see that, no, that's not how it is, I do that. But the only way I would shut them up is because in Washington, D.C., that southeast side, they went through the same thing that we're going through in East Baltimore.
It ain't perfect today. Southeast, as they call it in D.C. I know about Southeast.
So when I say, you know how your generation, how it is, no one can talk bad about y'all, and then immediately like, okay, well, we'll go back East Baltimore, we'll check it out.
Right. Good. All right. So I hope you believe like me, and I hope that we're part of that change. Bob, I don't know if you want to, but we have a few minutes left before we go, but did you want to give an update to all partners about the J-chip process, or do you want to just leave that for another time or another
I could certainly do that fairly briefly. Because there are some new folks here, just to very briefly mention what this is. J-chip is an acronym or an abbreviation for something, and I'm not sure what the something is. So I can't...
Johns Hopkins Community Health Partnership.
Thank you. Johns Hopkins Community Health Partnership. Is that it?
With an I.
Yeah, so that's JJ. This is a federal grant that is a $20 million grant that has a few components. It's funded by Center for Medicare and Medicaid Services, and its primary purpose is to reduce the cost and improve the care of the most expensive and most care-intense of the patients served by Johns Hopkins Hospital. The most expensive and most intense patients costs on average $25,000 per person per year. So it's quite expensive. Many of the people who fall into this category have not only complicated medical problems, diabetes, hypertension, a whole combination of stuff, but they have complicated lives as well. They may have few, if any, social supports, and they may have problems with alcoholism, other substances, etc., etc. So you have medical problems and social problems together. Well, clearly, providing medical care is necessary for these folks, but it isn't going to be enough. And what often happens is that patients such as this, and you may well know folks like this who come into the hospital, they do better in the hospital and they get treatments, and they leave back to the circumstances in which they got them in trouble to begin with, and they're back in the hospital, and it repeats, and then they go back out and they're back in the hospital. So what's necessary really is to not only provide good medical care, but to provide a network of community-based supports. So the hospital system has begun to work. This is a very new project. It began July, I think, or so. So it's a very new project. And the medical system, the health system, is beginning now to work with a group of community-based leaders and community-based organizations that provide healthcare services. So it includes STAR, Sisters Together in Reaching, it includes Charm City, it includes the Men and Family Center, and it will include a growing number of organizations throughout 5 zip codes. Actually, probably more than 5, probably 7 zip codes, but like, so 21205, 241331, and one other that.
18, I think.
What's that?
18.
18?
Did you say 24? Yeah, 18 and 24.
02.
And then
Reverend Hickman has them.
205, 13, 20.
5, that's what I didn't mention. 5. So
And they do 22.
in this, which is a pretty large area of Baltimore. So there was a meeting last Thursday, I think, over in the health system buildings, and it was, I think, and the feedback has been from particularly community participants. It was an open and very frank conversation that began to set the stage for ongoing collaboration. First step. There are a couple of next steps that are also going to occur. One of the next steps is that the community groups who were there, and others, because I know that some folks here were there, felt and feel that there should be an ongoing, or at least an initial meeting of community individuals and groups to meet by yourselves to formulate ideas and plans. And that will happen, and that will go forward. The second is that there will be a follow-on meeting of the group who met, plus additional community-based organizations, and that's going to be October 1 from 5:30 to 7:30. So these two activities are going to go on. The goal is really to develop a partnership in a way that it hasn't happened before, and that'll be real work. And if it works, it'll be real exciting. And more importantly, it'll have real payoff for the people in this community who will benefit from building that kind of community web of support. Would others who were there like to comment? You or Debbie, would you?
I just think that it's a very exciting time. It's promising in that we as community organizers, community-based organizations, need to stay in touch and stay in the rooms and become partners, true partners in every sense of the word, and a time by which this has never actually happened before. To my understanding, where community and Hopkins are coming together like this to bring about a total change in health and wellness that promotes health care. And I just think that this is an ingenious way to go about it.
I think another thing that is very exciting that I would just mention is that there's another initiative that's in the planning stage right now. And as exciting as this J-chip is, now that I know what it stands for, this is really an initiative of Hopkins reaching out to the community. But there is another initiative where there are community groups that are reaching out to Hopkins. And that's the Health Enterprise Zone. This is another initiative. But this time, and maybe for others who have longer memories, you'll know of other examples, but for me, this is the first time where there's been community and Hopkins collaboration, where it is led by the community, not led by Hopkins. And Hopkins is enthusiastically coming to the table as a member, as a participant, but not as a controlling share or a controlling voice. And that's, I think, even more change. So, Ernest, you're
around the J-chip meeting, because I've been following some of the email flow. Many of the people who did attend the meeting were, well, there was one, quite surprised by the meeting. Two, they were quite satisfied in terms of how the meeting went, and for that participation and that collaboration and that desire that we all come together, that everyone comes together and try to figure out a way to make this thing work. And so, and the willingness, even more interesting, because I think in a lot of cases, we have been in situations where community members wanted to say, well, we want to have a meeting, and unfortunately, people from Hopkins have said, no, this isn't going to happen. But this time around, it was like, well, yeah, we want you to have the meeting because we need you to be able to figure out how you're going to participate. We need your true and honest participation and an understanding of how that works and how you can help move this forward, which from a community perspective was an interesting statement because that's something that generally does not happen, as Bob was pointing out. And so, as you pointed out, the doors are beginning to open. There's many people are now beginning to feel a sense of collaboration and a sense of working together, that there is opportunities for everyone to work together. But we all just have to be diligent and do what we all need to do to just make that happen. So this is a good time.
Being the old broken down piece of social worker that I am, I just have to take the opportunity. I want to be real clear about what all that collaboration, all of it works mean in terms of what the role is for the community. I think from my school of thought, we're talking patient environment fit, person environment fit. Why people keep coming back to the hospital is because we have not figured out what supports people need in their communities in order to stay well. And nobody can define that better than the community itself. And so, you know, you can surround and play all you want for all medical programs. The person that's in this environment that doesn't work and you don't know this environment. Right. And so, critically thinking, this is the first opportunity that that community gets to define what it is that people need for wellness. That's the role. And I say, so even though you're hired as a data collector, you're hired as something much more than that. Absolutely. You are the resident expert. Nobody knows better than you what people need in your community. And so I would invite you not to just take this job of being a data collector, but to come to the table and speak the truth about what people need.
I would so strongly second that, because one, you bring that anyway, and you will only get more and more of that as you go out and speak with people in your neighborhoods. And so to be part of this momentum and bring all of that experience, I could only agree 1,000%.
Well, that's why I like it too, because I was also part of the EPI movement, and I felt like at one point in time we had no voice about our homes. My mother brought her home, she was so proud of me, my mother and my son. And all they were told was that, you know, we're going to come in and we're going to pay for it. So, and then we'll help you relocate. But we were fine, but, you know, they wanted the area. So it's kind of good to do this as they collect it and have the people or get the opinion out of this because we had no opinion. A lot of people probably felt that way, even though it's good now we see the results of it, which is great for the community too.
But the process of it.
The process we just wait, like we waited a whole year before they even came through.
Yeah.
And then it was done within 2 months and then we were gone.
Well, this is about doing business in a different way. Not just a different way from that experience, but in a different way than it's been done before. And it's not easy because you know far better than I. It takes a lot of work to build trust. And you only get beyond it if you do the work. And one of the things that has happened in this All Partners Group is there has been a lot of work that's gone in. You know, I mean, it would be crazy to say there's 100% trust. But compared to where we were 2 years ago, whew, night and day.
Ms. Constance.
I just want to comment, and it basically piggyback off of everything that has been said. There has been in the past, and probably still is, great mistrust for Hopkins, because we have had others come into the community and say that they going to do this and they will help us do this and do that, and then at the same time, we watch them get their PhDs or their book royalties, and they just move on, and we're sitting back there waiting. And I think this once for once, and as you said it yourself, this is the first time community gets to speak first. And we have John Hopkins listening, but John Hopkins is a great supporter because it's the largest institution over here in East Baltimore. And I think this right here, it might work. It just might work.
There are a lot of us who are both hoping and betting on it. And it's because of you. Because of you. It's your voice coming to the table and everything that you will bring.
In the spirit of how we're trying to collect data, I would urge all of us to see that mistrust as a sign of, as a real asset. I mean, I see a community that has produced mistrust as a community that has the resources to protect itself. A community where people talk to each other and encourage each other and tell each other stories of bad things that happened, so that the younger or newer people don't make the same mistakes or get caught in that same trap. And so I really think it's important that we really give up, I would give up, if a community that had been exploited didn't have mistrust. I mean, that would be a dead community. Yeah. So it's something for us to battle, it's something that we want to overcome, but it's not a bad thing. To me, it's not a bad thing. It's a sign of health. To me.
Right. And part of this process will also help understand that better, which gives us a chance to overcome some of that.
Thanks, Bob. I would argue that we are now overcoming. It's not something that's just going to happen one day. If nothing else was going on, we started a process 2 years ago that is still going on now because we wanted to go on and we're staying involved. That's change right there. It isn't perfect, but it doesn't have to be. We're moving forward. The next phase is now, and we'll continue going forward. Great. Anything else we need to discuss tonight? Any other comments anybody had? Yes, I'm sorry.
I don't have a comment to an announcement, but I don't know what you mentioned.
Sure, yeah.
Should we vote? There is a thing going on in East Baltimore called the East Baltimore Historical Library. And part of that is a project called I Am East Baltimore, where they are going to be collecting stories of people who live in East Baltimore and who want to tell their family story. And actually they'll be turning them into picture books that will be part of the historical library. So I didn't bring the forms because I forgot. But I will make sure that you get the information if you want your story told as part of I Am East Baltimore, that you were able to do that. I certainly wouldn't tell mine.
Yeah.
But maybe an encyclopedia would be
Great, great. So we'll get that as soon as Adrian gets that to us. We'll get it out to you guys whatever we can. Anybody else? Any last words? All right, my friends, thank you so much. We'll see you next time. Please take some food. We got plenty of food in the back. Take it, and we'll see you next time.